Hello, my name's Nick and I live in London, and I'm here to tell you an important story that warrants public attention as it exposes how the NHS intentionally breached healthcare policies that's put my sister's life at serious risk in an attempt to avoid accountability and financial redress. So my sister Lisa, here she is, she lives in Cardiff, and she's undergone 12 years of medical neglect and misdiagnosis after suffering a rare surgical injury during a routine disc operation on her spine back in September 2007. Her spinal cord membranes were torn, which led to a massive loss of cerebral spinal fluid, CSF, which is a clear fluid that protects the brain. This was left for a whole month collecting at the base of her spine like a large grapefruit and causing horrific head and back pain until a neurosurgeon finally operated on her. But the horrendous head and back pain never went away from that day. The surgical injury has left her with multiple rare diseases, and she's in constant debilitating pain from the top of her head right down to her feet that's causing deteriorating pain and putting her health at serious risk. The post-surgical diseases that Lisa has been left with are totally unrelated to the condition for which the surgery was intended to treat. And the failings of the UK medical system, both NHS and private, to thoroughly investigate Lisa's post-surgical deterioration and to offer her a diagnosis and treatment plan in a timely fashion has exposed her to inhumane and degrading treatment and willful neglect, which is discrimination and a breach of the Human Rights Act. So we're campaigning for the Welsh NHS to honour their duty of care to Lisa and fund these pioneering surgeries in the USA that Lisa is in urgent need of. Lisa is fighting for her life every day, and she's fighting to be heard, but she's bound by red tape and bureaucracy, and we've been forced to raise funds and travel the world in search of a diagnosis. And so back in April 2019, Lisa finally obtained this definitive diagnosis and treatment plan from a pioneering neurosurgeon over in New York. The majority of the neurosurgical treatments that Lisa requires are not carried out on the NHS, and she requires a multidisciplinary team. So her diagnoses include arachnoiditis, which is a chronic inflammation of the inner spinal cord membranes that permanently damages the spinal cord and nerves, craniocervical instability, so the spinal cord can't actually take the weight of the skull, as there's a pathological deformation of the brainstem and the upper spinal cord. She's got jugular vein stenosis, so both jugular veins are being compressed, and this obstructs blood from leaving the brain and returning back to the heart. She has intracranial hypertension, so high CSF pressure in and around the brain and the spinal cord. And she has dural ectasia, so an enlargement of the membrane surrounding the spinal cord, which is caused by a weakening of the connective tissue following that surgical injury back in 2007. And she has a secondary tethered spinal cord, so this condition fixes the cord to the spinal canal, and this causes irreversible damage to the spinal cord and nerves. I mean, as a family, we should not be expected to raise the funds to surgically rectify a multi-complex illness that was caused by and left to deteriorate into multiple rare disorders by UK senior consultants. So we now have to raise over £300,000 in order for Lisa to receive the pioneering surgeries that she urgently needs in the USA. But the Welsh Health Minister, who's also Lisa's AM, and also her local MP, have both refused to meet with us. And so as a family, we can't discuss the way forward for Lisa. But without the core principles of duty of candour and the Human Rights Act being upheld, there is no accountability for the surgically injured and other vulnerable patients. And as a surgically injured patient in the UK, Lisa was repeatedly misdiagnosed. Senior neurosurgeons deliberately withheld information in an attempt to protect negligent colleagues and cover up the serious complications of the surgical injury. She was denied access to pain relief. She's been subjected to verbal abuse, such as, why don't you just go and step it up at the gym and get over yourself, or go and find your own doctor, or go back to the man who caused this, I can't help you. Her medical notes were even falsified. No medical treatment really been offered to her. She's been abandoned and isolated from the medical system. She's been taken off waiting lists, Referrals have not been made, appointments were cancelled, and once she was even made to have to pay for her own pain management consultant, supposedly paid for on the NHS. Her NHS and GMC complaints were just totally whitewashed. And the judicial process overlooked systemic corruption and human rights violations. I mean, the health board in Cardiff have repeatedly rejected her funding applications for specialist treatment abroad. Over a 12-year period, Lisa has been subjected to unnecessary debilitating pain, disability and neglect that no surgically injured patient should have to endure. And this has got to stop now. Surgically injured patients are entitled to receive all relevant information regarding the harm caused to them, offered a timely diagnosis and an effective treatment plan, and public authorities have a legal duty of care to protect patients from harm in the healthcare setting, and this must be forced to be upheld. We've travelled all around the world. We've seen over 25 senior consultants in the UK, NHS and private. We've travelled to the USA 3 times, all over Europe and even to Turkey to get a diagnosis. Before the surgical injury, Lisa was a postgraduate student at Oxford University. But to date, she's not been able to resume her life and lives in chronic pain. There is currently no protocol in place to ensure the correct management of surgically injured patients. We believe Lisa's case really is a landmark case, and it highlights how new laws must be established in order to prevent this from happening to anyone else. So please help us, me, my mum and my sister, who cannot watch her suffer anymore. This abuse and neglect has to stop now. So you can sign our petition calling for the Cardiff and Vale Health Board to fund these treatments in the USA. Please call for an end to this total injustice for Lisa and for the thousands of patients in similar circumstances. Although we expect the Cardiff NHS to pay for these treatments, in the meantime, if you can contribute, please do via our GoFundMe page at the bottom of this YouTube clip. Please do share this video far and wide. And please, if this has happened to you or you have similar stories, please use the hashtag #ActionNotNeglect on Twitter or Facebook. Thank you for listening and wish us luck. Thank you.